We've been investigating a drug known as Belantamab mafodotin. This is a new class of drug for patients with relapsed and refractory multiple myeloma. What this is an antibody that targets a protein on the surface of the myeloma cell known as BCMA. And BCMA is a target which many of the CAR T cells are being designed to hit. And BCMA is a very nice target for myeloma because it is quite a specific target that sits on the surface of plasma cells. But belantamab mafodotin isn't just an antibody. It is an antibody linked to a drug conjugate. And in this setting, it's something called MMAF. What that means is that this antibody is linked to a highly powerful agent which is able to kill myeloma cells directly. So essentially, by infusing belantamab mafodotin through a vein, this antibody is able to seek out the myeloma cells. The myeloma cell engulfs and internalizes this antibody and releases this powerful drug conjugate from within the myeloma cells, which leads to the cell death of the myeloma cell. In fact, belantamab is able to kill myeloma cells through multiple different mechanisms of action, which also invoke the immune system being activated to kill myeloma cells. What we saw in the DREAM2 clinical trial was that this drug was effective for patients who had failed treatments with the standard agents that we would routinely use, namely a proteasome inhibitor such as Velcade, an immunomodulatory agent such as pomalidomide or Revlimid, and a CD38 antibody such as daratumumab. And the response rates were about 35%. And for those patients who responded to treatment, they lasted on treatment for approximately 12 months. And that, we think, is better than the standard treatments can perform in that setting. Now, of course, no drug is without their side effects, and this drug does have some. The main side effects that we observed was a low platelet count, which was able to be supported with platelet transfusions or interrupting the dose, but also that this drug does affect the eyes. And specifically, there are deposits that form on the front surface of the eye, which is known as the cornea. What this means for patients is that they can experience some blurring of vision, some grittiness of their eyes, and some difficulty with bright lights. Now, not all patients do develop these symptoms. In fact, 78% of patients have these problems on the surface of their eye, as noted by an ophthalmology doctor, but only about 55% of patients actually have symptoms. So not everyone develops the symptoms. And these symptoms, as far as we know, appear to be completely reversible. We think that by close liaison between the hematology doctor and an ophthalmology doctor, that we can manage these eye side effects and we can interrupt the dose and reduce the dose accordingly so that you can continue to receive this drug and benefit from the effects on the myeloma. Also, what you're going to see in the future is that this drug is going to be compared and added to standard of care treatments, and this will further enhance its activities.